Hi, my name is Gracie King, and today I'm going to be explaining the structure of the knee joint and the movement of the hips. But first, I'm going to start with the structure of the knee joint, and I drew a picture for visual. I don't think I can set it down. Okay, I'm going to step to the side right here. So first, I'm going to be talking about this picture. Okay, so our top bone that we have is our femur, and our bottom bone is our tibia, and these two bones come together and they sit like this on top of each other. Okay, so my femur, and then my tibia, and then my fibula sits beside the tibia right here. Okay, and on top of the tibia we have our lateral meniscus and then our medial meniscus, and this is like a cushion for like the bones sitting on top of each other. And then right on the bottom of the femur we have our articular cartilage, and then right on top of these two bones it's like a little ovular shaped bone called the patella. And then I need to flip it, it's hard looking at. Okay, and then in this smaller picture that I drew an extra one so you could see all of the ligaments and all of that. So we have our femur, our tibia, and our fibula. Okay, all right, on both sides of our femur and fibula and tibia we have our medial collateral ligament on the side that's on our medial side, which is closer towards the midline of our body. So me standing this way, that would be on the inside of this knee and the inside of this knee. Okay, so we have our MCL on the inside of our knee joint, and then we have our lateral collateral ligament on the outside. So laterally, so on the outside of our knee joint, which prevents our knee from going like side to side, like out of place, pretty much. And then we have our ACL, which runs back here, and it keeps your leg from going like forward and backwards. Whenever you go to the doctor, they'll like grab your tibia, and if it's a common sports injury, so if you go to the doctor for possible torn ACL, they'll grab your tibia and they'll pull it anteriorly, and if it goes too far past where it's supposed to go, then it is ruled as a torn ACL, and then further like imaging and things are done to like confirm it. Then you have your PCL, which runs right beside your crosses with your ACL. Pretty sure did all of them. And what's not pictured is the synovial fluid and the joint capsule. So our this joint needs synovial fluid because it prevents what's the word? Can't even think of the word. Friction. It prevents friction. It's like serves as like a lubricant inside of this joint, and then so it's like a fluid around all of this to keep all the friction from happening. And then on the outside to hold the synovial fluid in is a joint capsule. Okay. All right. Next, I'm gonna put this to the side. Okay. Next, we're going to be talking about the movement of the hips. Can't even see my legs. The movement of the hips. Okay, so first we have flexion. I'll turn to the side so you can see. So flexion, with my knee locked out, you just raise your leg forward. This is flexion of the hip. Okay. Extension of the hip is just kicking your leg back. Okay. No rotation of the trunk or nothing like that. Just extension, flexion of the hip. Okay. And next is abduction and adduction. Okay, so ABD, abduction, is away from the body, and adduction is to the body. Okay? Abduction, adduction. Okay, and then internal and external rotation. I might have to stand up here so you can see my feet. Ooh, my coach saw this video. I'm gonna stay on the chair. Okay. Internal rotation is whenever you rotate your foot inwards and your whole leg rotates with it. So your knee, my leg is straight, but your knee, your foot, like all of it goes inward towards your body. So that's internal rotation. External rotation is outward, going away from the midline of the body. Internal rotation, external rotation. Athletes use these movements every single day. Regular people use these movements every single day. So hope you enjoyed the video.